Idaho's biggest hospital system says they are ready to perform procedures and surgeries delayed during crisis standards of care.
We learned yesterday right here on the news at 4, more than 7,000 procedures at St. Luke's are held up. Andrew Bartline talked to one of those thousands of people. Andrew, tell us her situation right now.
Yeah, right now it's just wait your turn is what she told me. Karen Yambura, she received an MRI in August and got a referral for spine surgery shortly after. And to date, Karen tells me she still hasn't even spoken with a surgeon. Karen Yambura lives her life with daily pain.
I have pretty extreme pain. I'm currently taking opiates for. Some days it's really hard to get out of bed. Hurts so much.
And it hasn't always been this way. The back pain started in July, and an MRI in August showed she needs surgery.
I need a fusion. I have 4 bulging discs in my back, in my lumbar spine.
But Karen's surgery had to wait as Idaho hospitals became overwhelmed with a surge of COVID patients seeking treatment. At the state's largest hospital system, St. Luke's, they say more than 7,000 people are now waiting for surgery.
Working through that is going to be a logistical challenge that's going to play forward into our near-term future.
St. Luke's executive physician, Dr. Jim Souza, says the hospital system needs to work extra hours with extra staff to catch up, and even that won't be a quick fix.
And it would take us about 6 months to work through that backlog.
Health and Welfare says COVID patients continue to stress Idaho hospitals, but that stress also extends to the other patients in need.
Because of the backlog, I haven't even seen the surgeon yet.
Patients like Karen.
I have a lot of trouble wrapping my head around not getting vaccinated. I am very outraged.
She's waited patiently for months through daily pain and has lost parts of her life that bring her joy.
I like to keep the yard looking very nice. You know, picking up the leaves. You know, it's the fall and trimming the trees and all that kind of, I can't do it. I can't do it. I could last year, and it's very frustrating for me.
But that's just Karen's reality. For her and thousands of others, there's not much they can do.
You know, I have to wait my turn.
That's tough, and you've already waited so many months.
I have.
St. Luke's announced yesterday they are starting to move through joint, spine, and all cancer surgeries. Karen tells me she's making the call to get in line, and she's hopeful she can be seen and recover this winter and maybe get back to gardening in the spring.
I know when I've talked to health professionals, leaders at that level, they say these aren't elective surgeries. These aren't things people just want to get done. These are just non-emergent surgeries is how they want to define them, so that's very clear. These are things that people need, and a lot of people deferred health care throughout the pandemic.
You know what I'm thinking, Morgan and Andrew, when someone says, okay, why should I wear a mask? Why should I get vaccinated? Maybe think of Karen if you're on the fence.